Yes, I would say that in the HIV world, we kind of had it figured out. And part of the reason why HIV, I think, is a wonderful beginning model for population health management, beginning, I mean, like we were doing this 20 years ago in HIV delivery, is because patients were so sick and were kind of struggling so much to be able to get basic services that HIV care always demanded a team-based approach. So in order, for example, to kind of get your patient back in the clinic, you know, your medical assistants who might live in the neighborhood would reach out to the patients, for example, or whatever it took. So HIV care, I think, has always had an ethos in it of really being based on a team-based approach. And I think it's only now that we're seeing, as we're using the language of team-based approach, you know, to manage other chronic illnesses, it's only now that we're seeing in the HIV world that we've kind of already been doing this, and how do we pull it together as something that we can then talk about to other folks. So one example of how we do team-based care in my practice, and apparently how they've always done it, is, you know, we have these huddles, these case conference huddles, at least once a week, sometimes many times, and we'll talk about all of our patients that we're worried about. And when I say we, I don't just mean me as a provider. I also mean if the front desk, you know, staff saw a patient come in for like routine labs and that patient looked more disheveled than normal, or just didn't seem like they were, you know, themselves, the front desk staff will bring that patient up in our care team meetings and we'll say, hey guys, you know, I saw Mr. X and he didn't seem well. Can someone outreach and see what's happening? And so we all, members of the team, feel like we own our patients together, and that's how it's always run. I think one of the wonderful things now, in really thinking about, you know, population health delivery and team-based care being a really important part of proactive panel management, I think in HIV care, we're just figuring out how we translate what we've always done into the language that's being used now, and again, help our colleagues, let's say in primary care, in chronic disease management, figure out how to do some of the work that we've had.